Terrific. Okay, this meeting is now streaming live on Facebook. Excellent. Hello, everybody. This is Ryan Lanier with Organizing for Good here in Austin, Texas. And it is my favorite time of my whole week when I get to bring you a nonprofit shout out interview with an area nonprofit that is doing beautiful work. And today is no exception. I'm going to be talking today with Kelene Blake Fallon from the Maternal Health Equity Collaborative. Welcome to the show.
Thank you. Thanks for having me. I'm glad to be here.
So excited to hear all about what's going on with the Maternal Health Equity Collaborative. I feel like I've got an interesting backstory coming. Tell me what it's all about and who and how you serve.
Okay, well, yes, let's start with that interesting backstory. The Maternal Health Equity Collaborative, I just sometimes shorten it to MHEC.
That works.
We came together without a name. We came together in March and April of last year, so we're connected to the Community Resilience Trust.
April of last year.
So
forgive me. Go ahead. I thought I turned my volume down. Clearly I didn't. Continue, please. Apologize.
That's okay. The Community Resilience Trust was something that started as a response to COVID. And they started by bringing key people, organizations, folks together just on a daily phone call, Monday to Friday, every day, in order to just figure out what was going on and help people find resources and know who was doing what in our community to ensure that we're having an equitable response to COVID. Because the concern, yes, people are going to rally and start working and doing things, but we don't want the communities that tend to be left out of the efforts to get left out of this major pandemic. So that was a whole year ago, CRT started. And the folks on CRT identified areas that needed, where we needed to bring together folks in specific things. So they had education and they had public health and testing, and they also included maternal health. And they just literally just made a group email and drew in every midwife, every doula, every person working in the birth world, birth space, anyone that was in the network of folks they had. And so those initial calls were quite, emergent, right? Because it was an emergent situation. We were trying to figure out how do we support mothers, how do doulas support mothers when they're not being allowed into the hospitals, when the mothers themselves are in a situation when the hospitals wouldn't let anyone in, not even their partners. And what distilled to the top, and is always at the top of minds of many of the folks who work in health equity, is the disparity that Black women face around birth, childbirth, and birth outcomes. So it differs around the country. And in Texas, Black women are, for example, 2.5 to 3 times as likely to die from childbirth compared to a white woman in the same state giving birth. And it's also similar for complications, right? 200 to 300 times more likely to have complications, and 200 and 300 times more likely for the babies themselves to not survive their first year. So there are some drastic birthing and maternal health disparities in the Black community, and that concern rose to the top. If this is the situation when they have people in the room while they're in labor to advocate for them and to support them. How dangerous could this situation be if they are by themselves, right? If they don't even have their partner or a family member with them.
Absolutely.
So recognizing that, there were a few organizations who were on that call who are focused on that, focused on equity, focused on working with Black women and women of color. So the current term, not the most perfect term, but like the term we're using mostly these days is Black, Indigenous, and people of color. So that would include Black families, Indigenous Black persons, Indigenous persons, Latinas, right? Latinos,
Yes.
as well as Asian communities. So among a few organizations, we were basically specialized in working in these more marginalized and vulnerable communities in this birth space. So over time, we continued having those calls, dealing with situations as they popped up. Okay, this week doulas aren't allowed in. This week, we advocated for, a doula to get in, and now they have to show this. And, we would troubleshoot together, wanting to figure out, how we can give more people the option of a home birth, how we could give more people the option of a midwife, all these things. In these discussions, we found so many places where people, especially Black people, Indigenous people, and people of color, do not have options in terms of how they give birth.
Right.
So essentially, over the weeks, the months, now the year, the group that would meet on this call distilled down to 4 doula organizations and 2 supporting organizations. So 6 organizations in total. So hence the Maternal Health Equity Collective.
There we go. Collaborative. My own group is named the Calm Collaborative, and I have myself said collective, but we get it. We get it. It's a great word. So, and all those entities working together, that is absolutely amazing. The reason we're talking today is because I did interview Starla with Black Mamas ATX, and she was really excited to continue the conversation that we started. I learned so much about what all the issues that you're talking about, and so I'm so glad we're continuing this conversation. So, because you're kind of up against something pretty big here, it's going to take a lot of work, So, knowledge is power. Okay, so how, give us some nuts and bolts on how you're making, with these 4 doula and the 2 supporting groups, what are you doing?
All right. Well, to name the groups, what we found or what happens in Austin, I guess Austin is a small town, big city, right? What happens or what used to happen is if someone said, they were providing doula services or they were with this organization and this organization provides free doula services to, these people, someone would always say, oh, do you know this organization? They do the same thing. And do you know this organization? So this gave us this beautiful opportunity. And we all knew each other, like in this space, right? This birth space.
Oh,
But it
yeah.
gave us the opportunity to get on a call and work and talk. So the 4 doula organizations are Mama Sana, Vibrant Woman, Black Mamas ATX, which I am a part of, if you see my shirt, right?
Represent, very nice.
And Giving Austin Labor Support with his gals, and Healing Hands Doula Services. All right. And so these are the 4 that provide free doula services, but they do it in different ways. Right. And in addition, over the summer, Partners in Parenting came on as a resource for parents, and Hand to Hold also came on, and they specialize with families whose babies end up in the NICU so babies born premature. And so all of us are so entwined in this world of birthing and parenting. Um, but yeah, what we did was in our conversations, we basically made a Venn diagram of, okay, who does what and who does what
Good old,
well and
good
who
old Venn
doesn't do what.
diagrams. I mean, it's classic. It makes so much sense. So how smart. Okay.
Yeah,
And
because we're coming from a mindset, one, is not a competition. The need is huge and no one of us can cover every aspect of it. Communities of color are constantly dealing with health related disparities and health related, in some cases, mistreatment. And so in our conversations, we saw the things that were happening that were this, the things we all were seeing. We figured out our strengths, we figured out the gaps that, the things that we all wanted and wished someone would do. And so we came to the conclusion that as a collaborative, we could start working on the gaps. Not on by ourselves, it would be hard, but together we can do that. Our first major activity effort was get data. Because if we say mothers are scared to go give birth in hospitals, like at first it was very scary. Mothers were literally were giving birth at home, free births without support or help because they were afraid to go to the hospital, and it was a very dangerous situation.
wow.
So we would say that we would hear the fear in the mother's voices, and we would not, or like any birthing person, right? Any marginalized birthing person, because it's not only mothers, right? We have non-binary folks who also give birth. We have trans folks who also give birth. So in being inclusive and clear that people of color who give birth are facing intersectional um, disparities and marginalizations and all these reasons for them in an emergency situation like this to be very concerned about going to the hospital. So we said it, but we didn't have data. It was all new. So Measure, which is a Black woman-led organization as well, local here to Central Texas, we collaborated with them and created a survey and produced not just a Black paper, a report talking about that survey and the experience. And we found what we knew anecdotally was true through the survey, that the people of color who were giving birth were afraid to give birth at hospital, had experienced racism in either outright or as a microaggression during the period of time while they were pregnant. And we were only taking the data from folks who were pregnant and birthing during COVID. We found that people did want more options. Like if they had considered, if giving birth outside of a hospital, like if that was an option given to them, a home birth, or birth at a birthing center, which is an option that's super available for folks with insurance and money, but not exactly very available for folks who do not have the money and the space and all of that. So yeah, we released that paper. That's available on our Facebook page, always present if you want to read it. We created a timeline of how did this disparity even happen. So a historical timeline is also available that we put together and created along with Measure. And yeah, we released that. We spoke about that in October of last year. And we're still meeting every week and working through figuring out the gaps. There are several gaps that are systemic and just ongoing. And we're just working on ideas, proposals. How do we create a hub where someone who realizes they're pregnant can just come and connect to all the resources that are available to them in one place? How can we create a community that supports people? How can we fill the gaps wherever we can? And yeah, it's been a beautiful experience.
Well, data and communication, all of that's just where things have to start. If people don't know what's happening, that people don't know how to move forward, just options. I think that was brilliant. That was a great place to start. That's absolutely incredible. I loved all the organizations that you mentioned. I'll circle back with you and get all those, and we'll make sure we put those in the comments, because this was a lot of good going on. And I wanted to say, as you were talking, we are better together always. Can be so much more powerful when we band together, and clearly you guys figured that out, hence collaborative.
Yeah.
So, things are changing with COVID. Just, you want to give us an update as far as where you started and where things are now?
I would say now we've gotten to a point where we have learned to roll with the situations. It still changes in the hospitals as to whether a doula is allowed or not, whether they have to show some sort of proof of something or not. Like, it still changes, and we're still navigating those situations as they come up. But I think all of us have sort of acclimated to the pandemic we have lived within the last year. And so folks are just, folks have been, folks have had time to get pregnant and give birth and be postpartum, and all of that during this time. And so a lot of the fear has eased. And well, I wouldn't say eased. People live with a certain amount of vigilance and concern. Um, but a lot of the fear does not feel as drastic. And we're not really seeing as much of the folks being afraid necessarily, but we are seeing the needs and the resources are still at a low for certain folks. People still, we're still in a recession essentially, and birthing persons, families still need food, they need income, they
Yeah.
need
Still real bad.
yeah, they need a lot of resources and support. And so where we can, we work together, we connect people whenever we can. And we are working on bigger plans, right? In terms of we are staying together. We like each other, so we're going to stay together and continue building to fill those gaps, because a lot of those gaps were ongoing before, and they will be ongoing after. All of the issues we were dealing with will still be there, and so we're focusing on that, collaborating to create a more equitable Central Texas for folks who give birth, especially those who are typically marginalized, underestimated, underrepresented.
Wow. You guys are David looking at Goliath. That is quite, but you seem undaunted. You're just like, this is what we're doing, one person at a time.
David looking at Goliath, guess what? When all of us come together, we're Voltron. Goliath ain't had nothing on us.
Exactly. Oh, totally. Oh, I love that. I'm totally going to use that. So, this is great. My typical questions are, who are you? What do you do? And have things changed for COVID, which you guys actually came together because of COVID in a way, which is fascinating. And then my last question is, how can people support? How would you like to hear from people? What can they do? I always encourage liking and sharing the social media from the nonprofits. It sounds like there's at least 5 to 12 other ones that we can like and share as well. But, people getting involved clearly is going to be the difference for you guys. So can you spell out, the way people can help and get involved, or you have events or any of that?
Absolutely.
All of it.
So
nothing's off the table. Say it all.
I'll start with social media, and then I'll talk about upcoming events. Social media, our collaborative has our own social media at this point. We do not yet have a website, but we're working on that. The social media on both Facebook and Instagram would be our acronym MHEC. All right. So for I believe both of them will be MHEC ATX. You can search that, or you can simply search Maternal Health Equity Collaborative, and you'll find us on Instagram and Facebook. Our Facebook page has our documents. So like the paper, the report that I mentioned, the timeline that I mentioned, they're available there. The past meetings where we reveal that information. And we also would post on both Facebook and Instagram upcoming events. The organizations to follow separately are GALS, Giving Austin Labor Support, Black Mamas ATX, which y'all already followed because y'all had Starla on, Mama Sana, Vibrant Woman, Healing Hands, which I believe they have a Facebook, right? Healing Hands Doula Services. We have also Hand to Hold and Partners in Parenting. Those are the 6 core organizations.
Wonderful. Okay, and yeah, go ahead. Sorry.
Events.
Yes.
Yeah, the next thing coming up for all of us that's important to all of us is let me make sure I have the dates right. So yeah, April 11th to 17th is Black Maternal Health Week.
Wow, fabulous.
So many of us are going to have events, and they're mostly going to be virtual, but we have come together as a group to have a special event on the 16th and 17th. So if you know any Black or Indigenous or Latina or Latinx or Asian mothers, new persons, parents who have recently have a child, anyone in these categories, we're going to have essentially what we're calling it a garage sale, but really it's a garage giveaway, where we're taking all the the things that that we give to our mamas, the extras that we have, we're bringing it all out to Mother's Milk Bank.
I saw the social media for that. Yes, I saw called it free garage sale, which that's a good way to people will stop scrolling when they see free garage sale. So please keep going. I want to hear all about this. This is fascinating.
Yeah, we'll have baby items. That's one of the things people would give to our groups often, right? So, diapers, baby items. But we also have like household items. We have things like some kitchen things, some just milk things to help with breastfeeding, just in general, things that would be helpful for a household in which there is a new baby or pregnant person. And we're just clearing out, we're just bringing all our items to one place and giving it away to folks who need them and want them. So that's our event on the 16th and 17th of April.
That's amazing. So Doula Morgan is putting links as well on Facebook. She's popping stuff in there, and so is Karen. So all the information is just populating in there. Love it. So
yes, Morgan is amazing. Morgan is the ED of GALS, and yeah.
Wonderful. Thank you, Morgan. Appreciate that. And Karen. Okay, so that is amazing. I love that. That's another way of spreading the love, right? And getting the word out for sure. Okay, what else we got?
Well, just stay tuned. We have big things cooking. We have dreams.
Good. Gotta have a dream.
Big dreams.
Big dreams is
But big dreams with goals and plans. So
wonderful.
You're going to be hearing more from us in the upcoming weeks. We're building community, and we're looking out for mamas in ways that others have not even thought of yet. So
good. I think I just got like goosebumps, because really it's about passion and love and finding ways to make things better that shouldn't be the way that they are is really what I feel that nonprofits are all about. Is you see something you just can't turn your eye on, and you start to get organized on it. And this is like huge. I love this collaborative. I know that many nonprofits, there's a lot of partnering that goes on for sure, but like this is a very intentional collaborative to really build. I mean, whew, I
Yeah,
can't wait to
it's
see what you guys to come up with
it's
next.
one of the most beautiful things you have ever seen, and I get to see it. Most people don't get to see it from the inside, but it is a beautiful just experience and part of being a community. And I
Mhm.
do want to say, I mean, you can, and following our social media, that's really the best way to keep up with the
Sure.
needs of the individual organizations. I know Mama Sana is still doing, providing food for their families that need
Mhm.
food at
Mhm.
this
Mhm.
time. And, there's all sorts of individual organizations, events and activities that they may need volunteers for. They may need particular community support, resources,
Mhm. Mhm.
fundraising.
Mhm.
So
Mhm.
just look at all of us as a family, and each member of the family
Mhm.
needs their own support and is
Mhm.
doing
Sure.
their own thing.
Sure. So is there any more support people could provide to this garage sale?
Um, we might we might need volunteers.
Okay.
Um, we're thinking through if we need delivery drivers as well, just in case anyone is unable to come to
Mhm.
their sale, but they do need something.
Mhm. Mhm.
So we're feeling that out.
Mhm.
But if someone wants to contact us in our social media,
Okay.
like DM us and let us know that they would be willing and available to volunteer on those days and what times.
Okay.
The event is certain times of day, but we would need help before and after,
Sure.
right?
Sure.
So
Okay.
whatever people can do to support, we'd love to hear that. You can just DM and we'll have you on our volunteer.
Okay. That's to the MHEC.
Yes,
Or I mean, probably,
on any of them,
yeah.
but yes,
You
for
guys are
our
all
MHEC.
talking, but specifically to the Maternal Health Equity Collaborative Facebook page or Instagram. Send a
Yes,
DM, send a Facebook Messenger, say, I want in on this goodness. How can I help?
yes, and also spread the word. Like think about your
Mhm.
community, right? There is a person of color, a family of color who could do with like a free playpen or
Mhm. Mhm.
and something for the kitchen or
Mhm.
a
Mhm.
blender,
Mhm. Mhm.
so think about your community and direct them to this. We want to give everything away
Yes. Yes.
to
Only
folks
want to
who,
move it once.
pardon me.
We only want to move it once.
Yeah. Yes.
Don't make us move it twice.
So connect your community members
Yes.
to us so they can also benefit in this
Okay.
event and in general.
Yeah.
If you know you're someone in your community, or you are a person of color and you got pregnant or you are pregnant and if you need an emergency doula to come with you to the
Mhm.
hospital, call gals.
Wonderful.
If you have a high risk pregnancy, call Healing Hands.
Mhm.
If you are a person of color and English is not your first language, for example, you might want to
Mhm.
call Mama Sana. Like every one of, if
Mhm.
you're a Black mama, send them to Black mamas, right?
Yeah.
Every
Yeah.
one of us, we do things for our community, and together we hold our community. Someone can be involved in more than one of our organizations. You
Right.
know, if
Right.
so, send folks to us, because
Absolutely.
that's people don't always know what's out there. Let
Mhm.
people know what's out there. Tell people we're
That's
out there.
great. Is there anything I haven't asked you yet that you'd like to share before we wrap up?
No, I think that is it. I think it was a really great chat.
I think so too. I feel both, you know, anger for the cause of the need for the collaborative, but I feel excited for people taking control of what they can take control of and helping one. I mean, boy, you help one person and you're like, oh, yes, it's really about helping one person at a time, but all of us together spreading it out. So I so thank you for your time today. That was really enlightening. I'm jumping up and down. I love that this is leading up to your event as well. This keeps happening where I'm interviewing a particular nonprofit and they're like, this is the best time for us to be talking because like blah, it happens over and over. It's kind of cool. Makes
Timing
me
is
really,
beautiful.
really makes me super happy. So that is thank you to everyone that watched, that is going to watch in the future and share this interview, because we need to get this news out so we can support the people that are already doing the support, and then we all can move things together faster and stronger. So again, thank you for watching this nonprofit shout out interview. My YouTube channel has all of the nonprofit shout out interviews. If you just want to turn that on in your ear and just get all the good feels about what is going on, there is really incredibly beautiful work going on. So I'm Ryan Lanier of Organizing for Good. I'm in Austin, Texas, and bringing you news about what's going on in nonprofits is a passion project of mine as well. So I hope that you enjoyed it and that you will follow my socials as well and see kind of what I've got going on, because we're all trying to do a better turn for the world. So thank you so much. And we will see you next week. You know what? I was supposed to know who I'm interviewing next week so I could say that at the end. I don't remember who I'm interviewing. I don't want to mess up and say it. So there will be another interview next week and every week. Okay. Thank you.